whether we are naturopaths or doctors of Chinese medicine, or if we're nurse practitioners or medical doctors, osteopaths, we all have a similar interest and passion for the plants, the healing medicinal plants, and that's why we're here. And when I think about that, and I look at the way that we approach medicine from that botanical medicine mind, the word that comes to me is slow medicine. It's the slow medicine approach. It's kind of like the slow food movement. We want to make sure that, you know, we're saving our heroism for the moments that truly need it, and not trying to be heroes when all we need to be doing really is just showing up every day and being present and taking care and tending to those who are in need. Stress. You know, you've got your poor stormtrooper torn up about life. Am I joining this army and this military? I really need some sleep. I really need to calm down, but my life is about war and struggle. So what happens when your life is about war and struggle? And, you know, we're often in a war in our lives. We're in a war with microbes. It's kind of the war on microbes. It's been promoted. We've got this kind of battle to be financially successful. We've got this battle to find fame. We've got all these, you know, all these places that we are stressing ourselves out. So I talked about the pesticides and just the evolution of what are called endocrine disruptors. Plastic, you know, we just, you know, there's so much information now. It's just unbelievable that we're not done with plastics, or have created plastics that actually break down instead of using the ones that are completely non-water soluble and just sit in our environment for, you know, hundreds, if not thousands of years. They break down in small bits, and they're just getting into every aspect of our world. You know, recently a paper came out in 2018. It was raining plastic in Colorado, and that's because the hydrologic cycles bringing the plastic from the big gyres of plastic that have gathered in these islands in the ocean are being slowly just broken down and denatured into little teeny bits of plastic molecules that are floating in the ocean, and then being lifted into the air and then dumped onto the land. And it's all around us. It's everywhere. So let's talk about estrogen prostate cancer and in, you know, benign prostatic hyperplasia, BPH. So in a lot of men with prostate cancer or BPH, there's an elevated estrogen to testosterone ratio. Really important. The testosterone to estrogen ratio is an important marker in men, especially as we age, because the estrogen androgen ratio changes in favor of the estrogens as we get older, and especially if we have any obesity, because we have those adipocytes, those fat cells, converting the testosterone into estrogen. So we end up with more estrogen. Of course, things like sugar and the glucose and insulin system get right in this as well, but we want to make sure that we're keeping an eye on this in these men who have prostate cancer, because this is a big part of the picture. So as I was saying, leading up to this point, that low testosterone is obviously associated with a higher risk of having prostate cancer, but even more importantly is that low testosterone is associated with more aggressive prostate cancer. That's really important. So higher Gleason score. And when you look at the risks of prostate cancer, you know, we can see right here, occult prostate cancer is more common, but the most important thing is that patients with prostate cancer who had low free testosterone, so basically they were biopsied, determined to have prostate cancer, their labs were run, their testosterone was low, those people had more extensive disease, meaning it had encompassed more of the prostate, gotten into the lymph system, or even got to the bones or other areas. So what about radiation? Well, here's a study here from The Lancet, 2014, 32,000 men treated between 2002 and 2009 in Canada. 22% of these men had some form of hospitalization, okay? A urologic problem, an anal or rectal procedure was needed, an incidence of secondary cancers that were generated from the radiation, and needing open surgical treatments to fix the problems, because radiation induces fibrosis in a huge way, okay? I've got some solutions to help with men who do go under radical or radiation, who do have that therapy. I've got some solutions that you can present to those men. Just to bring it full circle, testosterone and cardiovascular health. If you have sufficient to high testosterone, what are the things that happen? Decreased blood pressure, decreased total cholesterol and LDL and triglycerides, decreased body fat, an improved waist to hip ratio, decreased serum insulin, that big risk factor, decreased fasting and postprandial glucose, increased high density lipid cholesterol, protective cholesterol, increased insulin sensitivity. Testosterone also dilates the coronary arteries, improves blood flow to the heart. So nettles, that's one of my favorite plants. It grows in my backyard. I have a wonderful nettles patch. I think of this as just one of the great gifts of the botanical realm to human beings. And nettle's known for so many great things: the seeds for renal function, the leaves for nourishing the blood, and the root very specifically for controlling what's called sex hormone binding globulin, the hormone that binds up our sex hormones and holds them together. It's really wonderful. So here you go. This is the holistic treatment goal. Treat the patient as an individual, always first and foremost. Address the pathological factors. We'll determine what they are first, then address them. Correct the endocrine imbalances. I gave you all the data you need to follow those and all the labs that are necessary. Improve cellular detox. We talked about all that endocrine disruption. You got to get that under control. Get the lean body mass back together. Get the fat tissue down. Shift that estrogen to testosterone ratio. Get the sleep working well. Reduce the stress. Those things go together. Keep bowels functioning. I didn't write that down here, but that's very important. Keep them at a normal, regular formed bowel every day. Balance the neuroendocrine system. Support the androgens. Get that testosterone level where it's supposed to be in that kind of normal to high normal range with lots of free testosterone present. And then target the prostate cancer specifically. And that's a whole nother kind of talk where we get into things like artemisinin and specific agents that can be more anti-cancer.